If you've been diagnosed with depression, anxiety, or PTSD, and normal medications or therapy isn't helpful for you, you could be a good candidate for ketamine. Ketamine allows you to go inward and find root causes for these issues. You may not be a good candidate of ketamine if you do have uncontrolled hypertension or certain psychiatric disorders, but move forward in scheduling a free consultation with us, and one of our nurse practitioners will be gladly to clear you and go over your medical and psychiatric history. You do not need a referral to come to us for ketamine, so go ahead and give our clinic a call and one of our representatives will be happy to help you. So why is ketamine effective? Ketamine, like many other psychedelic therapies, increase your neuroplasticity. And what neuroplasticity is pretty much makes your brain malleable, and where you can relearn patterns and habits that you really see for yourself moving forward and building that life that you really want. When you think about a forest that's all dry and shriveled and there's no branches and there's no leaves, that could be your neurons in a way when you've had years and years of depression or stress and anxiety and you just got used to that pattern of thinking that way or feeling depressed or feeling anxious. With ketamine and psychedelic therapies, we kind of water those branches and kind of picture the forest growing, the branches growing, the leaves blossoming. That's kind of what's happening to your brain with your neurons building those connections and kind of rewatering those patternings there for you. So with ketamine therapy, you do have a window of neuroplasticity that follows each ketamine session. That is where we'll aim to have your integration calls so that you can have an experienced guide and coach you through what you felt and experienced through your ketamine, so you can really grasp onto everything that you've learned and work on creating those permanent habits and patterns that you see for yourself in your future. So with ketamine therapy, we want to help you come in and remember who you are as a whole person without the labels of depression and anxiety, PTSD, trauma. A lot of times we get those diagnoses and we hold on to those attachments and to those stories and to those labels, and that's not who we are. We are not our depression, we are not our anxiety, we are not our PTSD. We feel depressed and we feel anxious, and those emotions come and go. When you come in and get ketamine therapy with us, we'll help you detach from those stories and detach from those labels and find who you are again, because we are all whole inside and we just need to remember that. So when you come in and get sessions with us here at Within, you're not a client or a patient, you're our friend and you're coming home, and we're going to work through this together hand in hand, and we're going to help you remember that you are whole without any of those labels.